What's his behavior and all that?
With or without drugs.
He'll punch you. He'll. He used to, be real aggressive, real rowdy and stuff. But now he seems to be more tired most of the time and sleep a lot.
He's kind of lazy and he gets crazy a lot.
What happened was he was biting everybody. He bit me in the face. He was just doing all kinds of nasty stuff.
Schizophrenia is a condition that's mostly, mental in nature, meaning that schizophrenics have various delusions or they hear voices.
How did you feel when your mom put him on Prozac?
I thought it was kind of hilarious.
Why?
Because cats don't usually go on Prozac.
Approximately 10 or 12 years ago, the American Veterinary Medical Association recognized behavior as a legitimate specialty and created a specialty college in behavior. But in general, observing animal behavior is something we've done since we've been in existence.
His behavioral traits, when we first got him, he was like extremely needy. You had to carry him like a baby. And it goes back to the way his mother treated him when he was a baby. Because his mother would throw him behind furnace fence and throw him behind the couch where you couldn't reach him. And if you'd have to like move all this heavy stuff to get him, and then you'd put Mr. Socks back in with his mother, and what would his mother do? Throw him back out. We brought him in for a urinary tract test, and he did have crystals in his urine. And when I brought him into the vet, he became a lion. The vet wouldn't even go near him without gassing him. He started going, he was making like really weird noises and hissing, and he was gassed and he was fighting the vet through the gas. You could hear him in the back room screeching. So she put him on Prozac and said, give it a month or two. And
probably the most common behavioral disorder we deal with in cats would be elimination issues. When we bring cats into our household, one of the attractions for having cats as pets is they use a litter box, and we don't have as much concern about taking them out like we do with dogs. So a lot of people who are limited time or space are attracted to cats for that reason. And one of the problems we have is when they decide not to use the litter box, and there are a variety of reasons why that can happen, but that's probably the most common reason that a cat would be presented for us for behavioral issues. In addition to that, aggression is probably second most common, and that can be aggression directed towards the owner. It can be aggression directed towards strangers who enter a home.
I don't really think he has a behavioral problem. I just think, he's just a cat. That's how cats act.
When he goes crazy, he attacks our ankles and sometimes scratches.
Does it hurt? Has he injured anybody before?
He has never injured anyone.
Since Mr. Socks has been medicated, he's gotten a lot more mellow, laid back. He just kind of sleeps a lot. And he has changed as a cat.
He's really fat, and he eats a lot. I don't think he needs it because he doesn't go that crazy that he needs medication.
Sleeps all the time. She wanted to find out how he was in 7 days. Maybe it was too large of a dose, but I sort of like the way he is now.
So you're purposely over-medicating him?
Yes.
Most of the medications that are utilized as antidepressants in people, we will utilize in animals more for their anti-anxiety functions, and it will serve both circumstances, and we don't really even know why that's the case. Why in one case these medications are used to treat depression, in other cases they're used as an anti-anxiety drug. We don't know all there is to know about the physiology of the brain in people or in animals. So a lot of times we're just basing our use of these medications based on the result. If we have an animal with behavior X and we treat them with drug Y and the resultant behavior is Z, we make the assumption that the drug is responsible for that change. But we really don't have the ability to know specifically what's going on when we administer a medication. We assume that's having an effect on neurotransmitter levels, but point of fact, we really don't know.
I do think it's morally wrong to medicate cats against their will. They don't have a choice. It's wrong. It's wrong.
In animals, mainly what we look at is not necessarily the mental pathways, mental thought pathways, because we can't do that. We just look at primarily what behaviors are occurring and how they compare to what we consider to be normal. And so how does it differentiate between what normal behavior is and what is this patient displaying? And then we deal with it that way. So we can't know the specifics like we know in people, but we can really look at the result of those mental thoughts. What's the actual behavior that comes across? Mm-hmm. In a lot of ways, that is more pure. I mean, we're not kind of clouded by what our perceptions are. We just can look at and observe what actually is coming across in the animal's behavior, and then how it compares to the wild, for example, mm-hmm. or feral animals or stray animals.
It is, in a way, different to give behavioral drugs to cats than in comparison to me, because I would have a choice and I'd be accepting the drugs, but he's forced to take them.
Hey, Mr. Socks, tell me about your feelings.
Most of the drugs that we use in veterinary medicine are also medications that are used in human medicine, and we just adapt them for use in animals. The things to keep in mind about that is that most drug companies don't go through extensive trials with the Food and Drug Administration for establishing safety and efficacy, because it's just not cost effective for them to do so.
Why do you think that vets want to give cats Prozac and stuff like that?
I think they want to do that because they want to make money.
Absolutely. It's all about the money, you know what I mean? And just they're thinking of new scams to, spread throughout the world,
I think that doctors and vets give people and cats Prozac is because they just want to make money.
Pet-related pharmaceutical industry definitely stands on its own. The bulk of their business is obviously in the human line, but they have a pretty significant presence when it comes to providing pharmaceuticals for the pet industry, and they take it very seriously. So it's not there just for the convenience of veterinarians. They're definitely looking to make a profit, but they also do a needed service, because a lot of these medications, if we didn't have them available, we would have a difficult time treating some of the conditions that we do in pets.
Crystals are being removed. I think Mr. Socks is confined. Where is he? I think he's locked in that closet.